Uragit, KTN.
Now, despite Kenya's advancements in medical technology, the survival of thousands of newborns remain in jeopardy due to a severe shortage of nurses in public hospitals. Now, a new research by Kemri Wellcome Trust in collaboration with Capricorn and Oxford University shows that the crisis in neonatal healthcare is being driven by an overwhelming nurse-to-baby ratio, currently averaging 1 nurse to every 25 newborns in most public facilities. This is far below the recommended 1-to-1 or 1-to-4 ratio for critical cases. Jebet Birir has this story.
The research funded by the UK's National Institute for Health Research shows that while incubators, CPAP machines and other advanced equipment are available in some public hospitals, there aren't enough trained professionals to operate them or to provide the constant care that premature and sick newborns need.
Every day for 24 hours a day, nurses remain the primary providers of essential care for sick and premature newborns, responsible for managing breathing support, monitoring, feeding, administering medications, providing hygiene and emergency interventions. Nurse shortages and high patient loads can affect the delivery of this care. We acknowledge the importance of these findings and their critical contribution to strengthening health systems. This work highlights workforce development as being central to building a resilient health system.
Kenya's neonatal mortality rate has barely moved in recent years from 22 deaths per 1,000 live births to 21. These deaths make up 2/3 of infant mortality and more than half of all deaths in children under 5.
We have to do something to the nurse population, both in terms of numbers and distribution and training, and some other innovations that came out of the work, including the need sometimes to relieve the nursing force from some of the work that they do so that they focus on their real job of looking after the baby. And we found, without doubt, that a huge percentage, nearly all the work that's going to say about newborns is going to be done by the nurses. That's not new, that's practiced elsewhere in the world.
Adding to the crisis, many newly trained nurses leave for jobs overseas, a move encouraged by some government officials, leaving public hospitals struggling. The researchers warn that unless Kenya urgently recruits, trains and retains more neonatal nurses, progress towards universal health coverage and the Sustainable Development Goals could stall. For now, the reality remains grim as the survival of many newborns is dependent on a handful of overworked nurses. Jebet Birir, KTN, Nairobi.
Thank you, Jebet, for that story. Now, hear this. In Mombasa County, a shocking